The Department of Nursing at the School of Applied Science at Miami University celebrated its silver anniversary during 1993. We as faculty believe that it's important to appreciate the historical development of the department because seeing the road behind us can help us know where we're headed. We also have the unique opportunity of interviewing two people who are associated with the early days of the department. We have Ruth Ann Busald, who was the first chairperson of the department, and Dr. Jean Dockery, who was one of the first faculty members involved. Today is May 19th, 1994, and we've asked them to come together here to share some of their memories of the beginnings of the department. Ruth Ann, would you talk to us for a minute about the inception of the department, how it started, and some of the people involved?
Yes, I'd be happy to do that because it remains in my memory as an outstanding thing that's happened to me in all my life. When Mercy Hospital School of Nursing began to get prepared faculty, and you have to go back a little bit to the fact that when I first came to Miami, it was very difficult to get an instructor with a master's degree in nursing because there just weren't that many people around with that. Now, of course, we're looking for doctorates, but it was very difficult to get. So anyway, as our faculty at Mercy School of Nursing became more and more qualified and got their master's degree, they began to look at the situation that they found in diploma education and felt that it was just not fair to students who were top students in their classes to come to a diploma school. When they were finished, they had a diploma, not a degree. Mm-hmm. And so we felt, as we matured as faculty, that we need to do something about that. At the same time, the university, of course, was investigating the possibility of their branch campuses. And Mr. Theskin, what was Mr. Theskin?
Earl Theskin.
Dean Earl Theskin was in charge of developing the branch campuses. First he developed the Middletown campus, and then in 1968 they were hoping to open the Hamilton campus. And at the same time, nursing was saying, well, we ought to bring nursing within the university setting. And someone named Mildred Montag had just completed a research study, in fact, and in 1952 started 5 or 6 associate degree nursing programs throughout the country. This was sort of a landmark thing to do because prior to that, when you wanted to be a nurse, you'd say, well, hospital, that's where you go. You don't go to, how could you learn to be a nurse in a university? So Montag changed this, but she developed an associate degree program or a 2-year program. And of course, the standard hospital program is always has been 3 years from many, many years, well, almost from the beginning. And the standards of diploma education were very rigid, and we had the control of the state board, which we still have, of course, but at that time the rules were so rigid that they even said that if you wanted to graduate from a school of nursing, you had to have 1,090 days in that school. And, you couldn't vary that. If you missed 5 days at the end of that program, you made up those 5 days. So that's how rigid the rules were. Well, then when the associate degree programs came in, they had to make some changes. So the state board did change, but again, that's something that, I think we'll talk about a little bit later. But getting back to our situation, the university then was looking at the possibility of establishing AD programs, and it seemed as if you had a nursing program, that might be the way to go, because it was certainly formed around the junior college, or in our case, the branch campus here at Miami. So Dean Theskin and the director of the nursing program, Mercy School of Nursing, began talking to see what we could do. Now, before that time, in addition to the speech course that I mentioned that Dr. Phelps was the first person to teach that, we also began to develop the sciences. But what we had was a professor from Miami teaching a science course, like microbiology or chemistry or anatomy. But it was a structured course for nurses. Therefore, when the nurse finished that program, that course, she had no college credit. But of course, she did have credit in the hospital as having completed the course. So as our faculty said, we said, that's just not fair. So we began then to try to get the standard course at Miami. And we did develop some standard courses. I mean, not develop them, but we used university courses. Well, that worked out pretty well, but we still were not a part of the university, obviously, and we still felt that was necessary. So at some point then, Dr. Phelps, again, who was to be the director of the new Hamilton campus, put together a proposal for the School of Applied Science. As you can see, we owe a lot to Dr. Phelps, Dr. Bernie Phelps. So he put that together, and of course the state board thought that was pretty unusual. What did they think they're doing? They should have a nursing director do that. And that was, really, the people who ran the state board were very strong in that, and they met Dean Theskin down someplace in a meeting in Kentucky, and they told him, well, what do you think you're doing? You can't do anything in a nursing program without a nursing director. Well, then they said, well, we're going to have to do something about this. So they said, well, we want to approve any program. Well, the university's really upset about this because, I mean, who do you think you are telling the university what to do? We do what we want a program we started. Well, they didn't know about our state board. So, but then it was, Dr. Phelps did put this together, and Dean Theskin and Dr. Phelps and I, as a consultant at that time, went to an applied science department meeting, which right from the beginning the university wanted it within that department, the School of Applied Science, I should say. And so they said, okay, so here we go. Dean Theskin, and this has always amused me, Dean Theskin, all the work he put in to establish his program, he comes, drops me off, and drops Dr. Phelps off, and we traipse on to the School of Applied Science. Dean Bowers is there, and I'm telling you, I was treated like, no doctors ever treat nurses this way. Dean Bowers got up and took my coat and sat me down. Anyway, so the first item of business was the associate degree nursing program. Associate degree, okay. This program is here. Ms. Busald is here to answer any questions. You have this in front of you. What is your pleasure? We move that we approve this program, approve the program. Dr. Phelps and I were escorted out, and we met the poor old Dean Theskin rushing up to see what happened. Well, they approved the program. They approved it already. So anyway, but Dean Theskin was a great person and a great help to us, and helped us in the very beginning, as did Dr. Phelps. And President Shriver also. He had come from Kent State not too many years ago when I first met him, and he had established a program there in nursing. He'd been involved in it anyway. So he was very supportive, and always, from all through the years, was very supportive. And so we were very helpful. But anyway, in 1968, when the department was established, the nursing department, or the nursing school at Mercy Hospital, announced they were to close their program. And at the same time, we announced we would open the one at Miami University. So we had a lot of help from Mercy School of Nursing and from the director there. And that program then closed, which was typical of diploma schools at the time. Many were looking at the possibilities of closing their schools. They were very expensive, and also it was considered more of a service experience and learning on the job. Although by 1965, most diploma schools had become accredited by the National League for Nursing, which is was a rigid accrediting service. And so by the time nursing began to look and say, well, maybe we should move and become standard to move within the university, all those diploma schools were excellent schools, and they had to meet rigid requirements. But it still seemed not the way that nursing should be in an educational institution. So Sister Mary Collette was the administrator of Mercy Hospital, and of course by that in her actually over the school then. And she was an educator herself. And she saw this need for nursing to move. And so she made the decision then to close the program at the time that we were told by Dean Theskin and Dr. Phelps that it's going to be opened here at Miami. So actually there was no interruption of nurses in the community. Many hospitals had nursing schools because that way they had nurses. And when nurses graduated, they tended to remain there. Of course, that was the old way. The newer way was to leave, and so the hospitals were seeing their best graduates leave. So it was a little different than it had been in the past. But this worked very well, and in 1970, the Department of Nursing was established on February 1st, 1968, and we took our first students in September of 1968, and they graduated in 1970, so our first graduating class. At the same time, Mercy School of Nursing graduated its last class in 1970. Our class, the class at Miami, was very successful. Everyone passed the state board. We accepted 18 students, and 12 of those students finished in the 2-year period. And in the other group, the Mercy group, well, of course, they finished in the 1970 as well. But 12 of our students graduated the first in let's see, what was it? May, and they became the group that of that group there were 3 of the 18 that did not finish on time. So those 3 did later, and they passed the state board successfully too. So we're very proud of our first group of nurses, and felt very pleased with what had happened.
Great. Jean, would you tell us about your involvement with the department, how you came to be at Miami?
And when the Miami started its program, I was very much aware of it. And Sister Macrina, who was the director of nursing, of the School of Nursing at Mercy School of Nursing, was very foresighted and actually sent me away to attend a conference of ADN programs. I recall at the time she told me that I needed to be looking forward to perhaps entering into teaching in a program such as an ADN program. I remember calling Ruth Ann to ask her if she was going, and she knew nothing of the conference. So I told her about it, and we went together, I believe. But in a way, Sister Macrina had kind of a way of coercing you to move forward gently, and I think that was her way of doing it. So I had that kind of introduction before I even came to the program. I was recruited to Miami to become a member of the faculty, and I was rather reluctant in some ways to join. For one thing, the salary was rather poor. Actually, I was making more. And Dr. Phelps, Ruth Ann, well, Dr. Phelps, I think more was trying to convince me that on an academic year, the rewards of that. However, Mercy also functioned on an academic year, so that wasn't a real strong selling point at that point in time. I did eventually, after a number of lunch meetings, I think, and the like, I did join the faculty. And I don't know that you would even want this, but I remember as a faculty member, I made the front page of the Hamilton Journal. I wasn't aware that this was going to come, but here it was publication.
For becoming a faculty
Yeah,
member.
for becoming
Wonderful,
the faculty member here.
Well, could I put in a
But-
little something here
Absolutely.
with Jean? When we, our first year, we needed faculty members, and one of the problems we had in the very beginning is that the university thought with 20 students that the director could do the teaching, the clinical work, and everything else.
You were going to do it all.
I was going to do it all.
Okay.
And of course, we said, well, no, that is not what happens. Well, they didn't really believe me too much. Well, they did consent to have one more faculty member, which now that was a person who had been at Middletown's program, and so she came on board as the first faculty member. And I said, the state board said, well, that's not enough. You're going to have a nurse. You're going to have a maternity nursing course in the second. At that time, we were on trimesters. The second trimester, you just you just can't do that. You have to have another. Well, finally, Dr. Shriver and the state board director, executive director, got on the phone, and they had a lot of conversations, and finally established that okay, you could have that extra, but that person couldn't be hired until the second trimester. So anyway, I didn't have to teach the 20 students, which, by the way, we ended up with the 18. But anyway, with Jean, I had known Jean as an instructor at Mercy School of Nursing, and so it was natural for me to be looking to Mercy for faculty persons, and Jean was the person I wanted. I wanted her to teach in our second year. She's an excellent instructor in medical surgical nursing, which was our major second year course. So I went after her, and of course Sister Macrina Gracious was ready. They were closing, and she was ready to give up Jean. So that's where we are.
Yes, and I had already signed, I had my contract for that year, but Sister Macrina released me from it in order to come to Miami. I think one of the other things that I was kind of the person when Sister Macrina particularly wanted something done, somehow she pulled me because I recall she wanted the maternal child health and the pediatrics courses integrated. And people were saying that could not be done, so she coerced me into planning an integrated course of pediatrics and maternity. And I think this was one of the things, because on the trimester system we saw that we had to do some integrating of courses. And I did integrate the course, and with the being told that students would never pass state board. And every one of the students passed state board with this integrated pediatrics, maternal child health course. So when I came here, having integrated some of the courses, at least I had some degree of experience in doing that. However, Miami does not hire you ahead of time. So I was hired like almost a day before I was actually supposed to start teaching. And at the time, Evelyn Vandenberg, we were on trimesters. So Evelyn Vandenberg was hired to teach the psychiatric nursing, and that was to be the first trimester. We had students at Fort Hamilton on 2 units. I did the clinical, and Evelyn did much of the teaching there of that course. Now, but she was only hired for that 1 trimester. Then the remaining 2 trimesters would be med-surg and the whole of it. So I literally was planning the curriculum, developing the courses almost at the same time of teaching them. And the ratio was 1:16. And I had students on 4 different units in Mercy, and with the 16 students, and was teaching them because everybody else was hired just for the 1 trimester, so there was no other help at this time. But it was kind of fun in a way, and it did work out very well. There were many people in the community, and of course many people in the hospital, who were very suspicious of an ADN program. Ohio is a little bit conservative, and the only other ADN program in this area was one in Cincinnati. That was Dorothy Exler was the director, and she had sort of paved the way a little bit for it. But and we were also told, Ruth Ann, that you should not expect your students to all pass state board. No programs start a program and the first class pass state board 100%. Well, we were pleasantly surprised and pleased. Every one of the students who graduated passed state board. The other interesting thing, we could not be extremely selective. We had to have students in this new program at Miami. So we took just about, I think, anybody who would come, and some students had applied at Mercy when Mercy was phasing out, so it was not close. We had students in that class with ACTs anywhere from 9 to
99.
Yeah. So it was in this way, it was really very wonderful to have this mixture of students all pass their state board on the first try.
I'm interested in those early students. What were they like? How old were they? Were there any men in the early programs?
Well, the first year of our program, we got many students who had gone to Mercy. So they were this typical student who was young, right out of high school, matched each other pretty well on their credentials and everything. We had a couple students, in fact, Jean was saying, even if somebody walked in at the last minute, she had been in the service, and she turned out to be a great student and was a little older. So that was really probably our first experience with an older, that we had, since we were expecting we'd have a lot of older students. But so anyway, this first year, and so we did accept this girl, and she proved to be just a gem, But she came in. See, there's a big problem with nursing, and even today, you get into the nursing program, but you're not really in nursing. You're not admitted to nursing until a certain point when you get the letter from the nursing department. If the university accepts you, that's one thing, but you must also hear from the nursing department. So this girl had applied, but had not been accepted to nursing. We didn't even know she was there, And in she walks, and should we take her? Well, yes, we will. After all, we're looking for students, are we not? And anyway, as I said, so that's a good example of that. But anyway, the students were that first year. They were very much in the I'd say the diploma mode, which was You know, we do certain things a certain way. So we suggested, well, you won't need caps. Unless you want a cap, you wouldn't have to. Now, of course, caps in my background, and Jean's too, were the most important thing that you got. At 6 months, you were awarded this cap, and there's a big and diploma education, big ceremony when you were capped. So these people came, and they wanted a cap. So one of the interesting things I thought about it is that we conducted a contest university-wide, well, on the Hamilton campus. And one of the nursing students is the one who got the prize for the cap. So that cap continued for a few years, and I don't even think anybody has one now. But that was traditional in the old days.
Interestingly enough, because they were designing, they were going to select whatever they wanted, we thought they would select a really kind of strange, unusual cap. They went for quite a somewhat traditional kind of cap, because there were some very unusual ones designed by people. And they weren't just by nursing students by any means. There were some art majors and various other majors who were also.
That's the one the faculty thought they should take, was one from the art department, but they chose one of their own members, and it was a very conservative cap. But anyway, that's, you don't see nurses wearing caps anymore, but at that time, and of course them understanding and having attended capping ceremonies back home, they wanted to have such a thing. Well, we didn't have a capping ceremony, so we settled for a pinning ceremony, which most AD programs were doing at that point. So we were able to get out from under the capping, but we did then have and it's now called, what do they call it now, Jean? It's
convocation?
Convocation or something. We don't call it a pinning ceremony. But at that time, everyone was actually pinned. They would come up to the stage and get their pin. You'd pin the pin on. And so and you may have experienced, seen that, I guess.
Yes.
Yeah. So now I understand. Well, when we look around, they don't do that exactly in the same way. But anyway, we still have that convocation, but it's no longer called a pinning ceremony.
And I think one of the interesting things that, with the beginning of this program, there was some thought, I believe, on the part of Ruth Ann and some of the others of actually a baccalaureate program would be very good to initiate, because all saw baccalaureate nursing as really perhaps the long-term goal. But the university was not ready to go that route. They had had an experience earlier, some years earlier, with trying to begin a baccalaureate program, I think in connection with Christ Hospital in Cincinnati. And they had had some unhappy experiences with the league, in establishing it, and were a bit turned off with the whole idea. So it was, at that point it seemed more prudent to start with the ADN, but with the idea of eventually having a BSN. So basically from the beginning was the thought that we would eventually also have a BSN program.
Is that how the program came to be on the branch campuses rather than the Oxford campus?
Well, you mean the bachelor's program?
The initial program.
Oh, the initial
associate
program.
degree.
Because it was natural to have them established in branch campuses, which is what, of course, Miami had. And we did want to start at both campuses, Hamilton and Middletown. But we had some opposition, and a very powerful person who was the administrator of Middletown Hospital, which is now called, I guess, Middletown Regional Hospital. He said that now you can't possibly, and this we heard this every place we went, you can't educate a nurse in 2 years when everybody knows it takes 3. Because it had always been 3. So you can't, so our administrator, very powerful person in the Middletown community, decided that if we wanted to place our graduates in his hospital, they would have to have an internship in that summer before they could work for him. So anyway, we just forgot about that. We said, well, we just won't deal with that. We'll just forget about it. We'll establish it at Hamilton, and when they're ready up there, we'll establish it up there. And but this idea of you can't do something in 2 years when everybody knows it takes 3 has been really difficult. Well, it's no longer a problem, but it was a problem in the early days, and people, that's the first thing they'd say. Or they'd use some kind of a procedure that those nurses won't be able to do because they're not going to have enough time to learn it or something, and they tell you what procedure they were talking about. And we would get this from doctors, and we get that from everybody who would say, well, now they won't be able to do this particular procedure, and we just don't think they're going to be able to perform in the hospital. Well, after a couple years, our administrator kind of relented, and so we did move the program then to the Middletown campus in 1970, and they graduated their first class in 72. And I would like to mention the names of two other instructors who were early instructors. Marilyn Halloran, who came from the Middletown program, she was really our first hired instructor. And then you would all know, or many people in Miami would know, Joanne Techman. She was our first maternity nursing instructor, and she just was excellent. And so Marilyn was ticketed to be the coordinator of the Middletown campus nursing program, and you might know her husband was transferred.
Mm-hmm.
He worked for Armco, and she came in my office, and she was crying, you know, I've got to leave, and just when I was, you know, just what I wanted to do, you know. Well, anyway, she left, and so we had to replace her, but that was, those two people were our early instructors, and Joanne Techman stayed with us for several years, and then moved on to other, and right now she has a, has a position at the medical center in Cincinnati, UC Medical Center, and deals with physicians and nurses, and really she was just an excellent person, as was Marilyn, and so we started out a few people, but that was one of our big things. I think we had good instructors at the very beginning, and that's why our students were able to be successful, and I hope that that still is true today.
Would you tell us about, did you have something to say,
No,
Jean? Go ahead.
No, I was thinking that certainly starting here, and for the first two classes, I think I was here during that time, and I really did not want to leave Hamilton campus.
Yeah.
And again, was somewhat coerced to go to the Middletown campus
Is she being polite, Ruth Ann?
Yes.
as the associate director. I don't, again, this is kind of one of the little stories which we may not want to share, but when I was coerced to go there to be the associate director, it was interesting how much time the university spent trying to decide, one, what to call me in terms of a position, and whether, how the whole, what was this thing that was going on, what was this position? And there was no money. So I was told that that I would be continuing to teach full time, plus take on the associate director role, which there had never been an associate director, so you were sort of initiating the role, indeed. And with taking on this added responsibility, the university had no additional money. So in lieu of the money, they finally said, well, if we give you a title, would that substitute for pay? And then there was the discussion, what would the title be? Well, at the same time, they were starting a position called the coordinators of various departments, the coordinator of applied science, and all of those. Therefore, I could not be that because the coordinator was Dave Young of the Applied Sciences Division. So that was out. And I don't know, the president, the campus directors, and perhaps you were all involved, and they finally came up with associate director, and I received a letter, would I be willing to accept the title of associate director, and that would be in lieu of any financial compensation. This took a number of months. This was not something that was done just in a week's time. And finally, I said, okay, I will go to Middletown. I felt a little bit apprehensive because I was very comfortable with the people in Hamilton. I knew the campus director. I didn't know the one at Middletown very well, except by name. There were already 2 nursing faculty at Middletown who had been there now approximately 2 years. And I was a little uncomfortable with me coming from Hamilton as the associate director when there were 2 faculty there. Another slight issue was I was placed in an office with a window, and that was really, you got windows according to your seniority on campus, and here this new little one was coming into this. However, it really worked out very well. But there was no nursing secretary, and as I said, it was a role that really had to be developed as we went along. But it worked out fine, and eventually we did get a half-time secretary, and Marion Cottrell, who is presently the secretary of the campus director, was the first half-time secretary, secretarial support that we had. But it was an interesting time, and a time of real growth in terms of the overall department. And I stayed in that position until I went on a leave to return to school.
Would you share with us some of the things that were going on in the profession of nursing at the time and how they impacted the creation of the department?
Well, I think one of the biggest things going on was the establishing of standards for nursing programs. And the National League for Nursing, and I mentioned before that by 1965, were pretty well recognized as the standard setter for nursing programs, so that most people would not think to continue a nursing program very long without accreditation from the League of Nursing, National League for Nursing. So I think that was one of the things we're establishing from a pretty much of a, even university programs. I remember one program down in Cincinnati that they were treating their students pretty much like diploma schools were treating theirs. They would, for example, be in the clinic, in their clinical units for 30 or 40 hours and then take their classes beyond that in the regular university classes. And that was something that was, was going on and had to be changed, and it was changed. League standards, they came in and said, look, there are certain things that just cannot be. Students have to be students. They are not wedded to the hospitals, and so even university programs were not looking at that load they were giving their students. So when the AD program came in, see, that established credit hours, just like the university had. They had credit hours at the major universities too, but they said, well, 1 hour of credit for 10 hours of work, in the clinical area. So it was really awful, awful.
Goodness.
But the league then, those standards were across the board then. Not only, did diploma schools have to follow and change, so did some of our baccalaureate programs that were using their students in the same way that hospitals were for service and for service in the hospitals. And I presume there may have been some agreements between the university and the hospitals to supply these people, but anyway, so I would say standard setting at that point was a very big thing going on in nursing, and that really helped in most of our nursing programs to improve them and make them more educationally centered. That would be, Jean, would you?
Yes, I think it was a real change. I think the establishment of AD programs was the real impetus for changes throughout nursing education. And it was because as they saw that there were ways of teaching and utilizing time in a little more effectively, and also of making it, continuing to make nursing education a truly educational program as opposed to a training program. So those kinds of things were going on nationally. The numbers of associate degree programs were increasing, and that, of course, had an impact even locally. As of graduates were going out and proving that they could function, that certainly had an impact. And the hospitals were quite full then, and beds capacities in the hospitals were increasing. So there was this real need also for our nurses, and all of that I think had an impact on nursing education.
And one of the things, of course, was the state board had to change, and I mentioned that earlier on. And I remember going to a meeting of which the director of the program at Cuyahoga Community College, that was the first one in Ohio, and she came and they asked her to explain her program. And so she proceeded to explain how she was given credit for clinical work, and that was one, I think, and then they were given 1 hour for three practice areas in the clinical units. And so everybody here in these programs, knowing how rigid had been the rules, said, well, you know, how do you count that? I mean, how do you get your 1,090 days, which was standard, and how do you get all the hours? You know, there's sociological science have to be X number of hours, and nursing has to be X number of hours. And so they were counting the clinical hours as part of their practice area, and that was counting to, and they were able to get around the 1,090 days, or 80, whatever it was, because they had only a 2-year program. So the State Board had already allowed some changes there, but they still had to have the same number of hours. But when they were counting the clinical area as hours of credit, I mean, I could just hear the room just close and say, and this director says, well, doesn't everybody do that? Count what you're doing in the hospital as credit? Well, no, they did not. The courses counted. So that meant you had to have X number of hours in each course. Didn't even take into fact that you're out in the hospital for 10 hours of that course, perhaps practicing, or I shouldn't say that, you're working with your instructor in learning nursing. And so this was, I mean, the shock in that, I mean, it was a big meeting because we were going to talk about this new AD program that was developing in the country, and here we were with this, well, doesn't everybody? Well, very quickly after that, the State Board changed standards, and we began to think in terms of getting some credit for clinical work, and prior to that, it had not been true. And to use a standard, like, again, we were still a little bit higher in university by 1 credit for 3 hours, but Miami changed that early on to 1 to 2, just like the rest of the university, because we want to be part of the university.
And of course, the league was an impetus because the league says that within the university, things should be somewhat consistent in terms of lab hour credits. And throughout Miami University, the lab hour credits seem to have been 1 to 2. So nursing also fell in with the university standards.
That caused some problems, and I know later on you're going to ask about those, but the university, again, if you look back to our beginnings, the university thought that I could teach those 20 students as the director of the program. I mean, after all, 20 students, 1 to 20 is a good ratio, right? Well, of course, not a very good ratio for nursing when you get students in the clinical areas. So this was really something, and it caused problems, concerns, all the way through, almost in its very early years, to think that nursing, I mean, gee whiz, the chemistry department, when you're in a lab, it's 1 to 20. Why can't nursing in the hospital? It's a lab, right? Yeah, it's a lab. 1 to 20. Well, you know, we tried hard to explain the number of patients you have, the responsibility of the instructor, and that she can't really manage 20 people in clinical units, even though we tried sometimes and had to. But budget constraints and all, we were told, you know, I mean, after all, the university, I mean, no other department has that ability that they can lower their student-teacher ratio that way. Well, anyway, that really, and I can still hear people telling me in the university 10 years after we were in the program, now tell me again, why do you need a lower clinical student-teacher ratio in the clinical areas? Why do you need that? You know, and people who should know better, and I've been trying to train for 10 years, were still saying that. They still didn't understand that. We even invited the dean and the provost to come into the hospital and see what it meant to be a nurse. And I think we made arrangements once or twice, but somehow they could not get there. So anyway, that still is a little bit of a concern. And that's what, of course, makes the nursing department more expensive, too, because you have to have more faculty for students, particularly if you go into clinical units.
Because safety is such an issue
Yes.
when you take nurses to clinical
Yes.
areas. Did you feel part of the university when the department first started?
Well, I could answer that one because we had one building that was completed by the time we started in 1968, September, on the Hamilton campus. One building, so everything was in there. The classrooms, the library, the instructors' rooms. We were naturally we couldn't have our own little isolated area in nursing, so we were with the English instructors. And did we feel that we were part of the university? Because we were in their offices while they were discussing their problems, and they were listening to us. And one of the things, of course, one of our first faculty people, when we started our program, we couldn't even get into the campus yet when we were beginning to recruit. So starting February the 1st of 1968, Dr. Phelps and T. Michael Smithson, who was the records person, and Dr. Phelps' secretary, Mrs. Vaughn, and myself had an office at the Anthony Wayne, which by then was once a hotel, but by then was a resident home or something, a residence for people. Anyway, we had a storefront office, and we would sit in there, and everybody who came through, we would see, and they'd say, and of course we'd have these people go to Dr. Phelps and say, well, now, Dr. Phelps, I'm interested in your AD program, but do you think you can teach a nurse in 2 years? What everybody, and by the time that happened about 10 times, we used to just go like this while people said that. And even our famous man from administrator at Middletown Hospital came down and said the same thing, and he also used this particular procedure that they seem to think everybody has to do, and that your nurses won't be able to do that. But anyway, so we all heard what was going on. But getting back to our English group again, the first contact I had with the English group was a young man came in to be interviewed by Dr. Phelps to be the first English instructor at Hamilton campus. And he comes in with his beard, and of course, you know, you have to think of 1960s, and my being from a very rigid background as well, since I was a product of a diploma education. Here was this guy with a beard, big peace medallion down here. Big peace. Wow. Well, anyway, so he was my first contact with the English department. So later on, when we got involved in the department as our head, really that's where our offices were. And of course, I met this fellow again. He was a really super guy. And 2 or 3 other fellows were in the English department. They also had beards. And I came to think, well, you know, here I am, this old lady. Well, I wasn't so old then, I guess, worrying about beards. Well, I forgot all about beards after meeting those guys, you know, those fellows. And they were so good. And we had such a good time with them. And to think, well, you know, we really are we felt that we were in the university. That was fun.
Yeah. I think I was the first full-time instructor hired, and somehow the circumstances were very positive at the time. And as I said, I think being recruited made sort of a positive circumstance also. So I really didn't feel not welcomed totally in the university. As a department, I did feel that the university didn't understand nursing, and saw it kind of on the fringe.
Mm-hmm. More than just the clinical ratio.
Yeah, and I didn't really understand nursing as being a profession that you really look to real education of people. Mm-hmm. You know, in the minds, I think, of even some of the people in the university, they viewed it somewhat as training and perhaps not as academically challenging. And I think that has taken time, and I'm not sure we are clearly through that because of the way nursing education has developed over the years. Mm-hmm. And we're somewhat newer, although we aren't the only kind of programs that have developed that way. Education in some way came through some of that same route. But as an individual, I felt a part of the university in total. One of the things that I think made you feel a part of it, Dr. Schreiber was president, and he was such a welcoming kind of an person. I was always amazed how he knew your name. I remember being introduced to him, and it was rather brief kind of introduction. But the next time he saw me, and every time he knew my name, and that was always rather startling that he, with all of the people in the university, and that certainly eventually wasn't unique to me. I think he knew it of names of everyone. But it really kind of made you feel a part of when someone called you by your name and you really had not had any lengthy encounter with them. So little things like that, I think, did make you feel a part of it as individuals.
Yes, I felt that way too. I think Dr. Schreiber is, as Jean says, such a unique person, and when he would call your name out of all these people were going by him and say, hello, Ruth Ann, hello, Jean. How can he remember all that? So he was a great person. And he did, as Jean says, the atmosphere he created was really good for us. And he liked his program, and he liked nursing. He wanted to support us as best he could.
What kinds of things were going on nationally and globally, maybe in healthcare or otherwise, at the time the department started?
Well, one of the things, of course, were the riots. And Miami University, I remember a scene where Dr. Shriver, in front of, I think, what's now the Shriver Center, I think, the Student Center, was facing these hundreds of students that were all very angry, and we're talking about Kent State's operation and what happened up there, and how well he handled that. But I believe we had to close the campus maybe 1 or 2 days or something, maybe a week at that time. So that was an outstanding thing going on on this campus. And Miami, though, escaped most of that. I don't think there were a lot of problems. But that one confrontation I can so well remember, I think, how well it was handled. And students, well, they were angry, and they finally settled down and came back to school, and things kind of, I guess, at least on the surface, went back to normal.
Yeah, and I nationally, because of war starting and everything, again, we hit nursing shortages nationally, and there was the impact also locally. This in turn had some impact on nursing education. And nationally, there were changes going on in nursing education. There were changes because of the growing numbers of ADN programs that were being established. There was also this beginning emphasis that education should occur in institutions of higher education. So we were seeing diploma programs starting to close. Ohio was by far much slower, particularly in the Cleveland or the Northern Ohio section and in the Cincinnati area. Mid-Ohio seemed to be closing a little more rapidly. So that was a national thing that was happening that also was coming down and influencing somewhat locally. And again, you began to see medications, a proliferation, I think, of new medications, a proliferation of technology. And that also created some changes in how health care was being provided to individuals. So all of those things, a lot of emphasis was being placed on human rights and those kinds of things. And I think students were beginning to what we thought of as change in how they responded, what their expectations were in educational facilities. And of course that was, that was also something that we saw. It was a growing time, many.
And now we're looking at the contraction of hospitals, and then we were still seeing expansion of hospitals. And no one thought that there wouldn't be jobs for all these people being educated. And it's really, although it does seem that even in spite of the times, nursing goes up and down. It has times when it seems like, what are we educating all these nurses for? They won't find jobs. To the time that 2 years later, where are we going to find the nurses we need? So what's happening, of course, this is a more recent thing happening now, is nurses moving into other agencies besides hospitals. And hospitals are telling us, the time's coming when you probably won't even be able to educate your students in a hospital. You're going to have to find another way to educate. They're not going, from a time when that was the way you educate nurses to a time that, we're thinking things are different. But that is a later, occurrence. At that time, we saw tremendous numbers of people working in hospitals and nurses working in hospitals.
But I think we also were seeing that role change, even in the hospital-like settings, and that made, and it just sort of reiterated that this is not a role that is constant. It's kind of an ever-changing role, and the education must, I think it also made us more aware of the need for education, and if you want to call it practice or service, work together a little better. Because we kind of went through a period where they were, real kind of separated. And with all of the changes that were coming, a beginning nucleus of seeing that we really kind of need to have some interaction, a little better interaction with one another.
And that sort of started as we moved education, nursing education out of the hospitals. And when we would go into the hospital, then we would bring our students, and the director had little contact with them. The head nurse also the instructor had to be there, so the head nurse didn't have the same relationship with students either. So there was a big separation, I think called pretty wide separation, as Jean was describing there, of the fact that here's the education and here's nursing service. And for a period of time also, nursing education was doing the innovating. They were doing these things and doing all the research and everything, and the hospital nurses were, and administration, the nursing service director, just, they weren't doing that kind. So what was happening is that so-called innovations were coming from practice, or from education, where they should have been coming from practice. And so I think that's resolved a little bit. But at that time, there was, and again, the more we moved out of the hospitals into the academic setting, we did not have the same comradeship that we always had. Now, when I began starting out, and this was still pretty true in the late 50s, where you would be in a clinical unit and you would have, the head nurse would take a big interest in you as a student, because you were there, and that instructor may not be right on the site like she has to be now as we change the way of education. So there's a real closeness of head nurses and staff nurses with student nurses. So it changed a little bit because there was a different control. So I think that probably is still pretty much going on. But I see practice now, of course, today, in the present time, we have clinical nurse specialists and nurse practitioners, and they are now setting the pace, I think.
I think that we should also note that, yes, the students did get the majority of their experience in a hospital setting. But when we first started the program, we also had our students in public health. We had an arrangement with the public health department here in Hamilton where they did go out. Now, we were not attempting to really make public health nurses or treating them, but they did spend just a little time perhaps going into the home situation at that point. We also had, as part of one of the courses, they did a home study with one of the doctors, because we had a rather close relationship with one of the physicians here. And he would go through his patient list, and he would get permission from his patient to allow a student to follow them for a semester. And the students did like a huge study, a clinical study that was written up at the end of the semester. So, there was a little of some of this kind of activity. And we have actually had several students enter the program who those initial students followed in their home with this doctor, and they later came into the program. At the time they were following them, they were high school or junior high school students, as I recall. But that kind of thing was...
That's right. And the other area, you remind me of another area. Immediately we began to look for gerontology experiences, and we did do that early in the program. That we established a unit where students would go to they went to Maple Knoll and to Schroeder Manor in Hamilton, and were getting experiences in gerontology. Of course, that's a big field for nurses today. If they can't work in the hospital, if they can't find a job in the hospital, they certainly are. There are many, many jobs yet in gerontology, in the nursing homes and extended care facilities. So that was an area we touched right away too, as well as the home visits, which I think they did most of. That was a Middletown position, was it not?
No, it's Dr.
Was
Davis.
yeah, okay, I remember him now.
Here in Hamilton.
Dr. Davis, that's
yes.
right. I had forgotten
he
about
actually
him.
would share part of his patient with the family's permission.
Yes.
And these students worked fairly, not totally independent by any means, because we had the instructor and everything, but they made home visits about every 2 weeks, follow through, did teaching and follow through and case study and the whole bit. And for a semester, they would have a family.
you certainly alluded to some of these early on, but what were some additional challenges that were faced in the early days?
Well, again, going way back to the state board, and that was a big challenge because here we are in our offices I described before, and comes the report from state board. You can't start your program in August of 68 because not enough faculty people. Now this comes, see, we put this big state board report together and get it up to Columbus, and you have consultants coming. We had Stella Piotrowski, a dandy consultant, very supportive of us, very helpful for us. And anyway, we had to spend some time. Once that report was put together, then it went up to state board, and in about June, we got the report back that you can't start this program because you don't have enough faculty. And that was a big job. I mean, the secretary in the office there, she said, I saw your face when you read that letter. We thought we had worked it out with state board that they would accept us, and yet when they went before their board, they would not. They would not. Again, and that's when we eventually got that the other faculty member promised. And then the next letter came and we were approved. So that was, I mean, for a month or so it was quite difficult to think, here we are, we got this all ready to go, we got all these students, and they're telling us we can't open this program. Well, of course, there again, Dr. Shriver was our man who took care of all that. So that, to me, that was a big challenge. And I think the challenge of what we've already mentioned, of course, is trying to, for the university to realize that this program is university caliber and all that, that we need to do this and we need to bring nursing here. I think that was, and the clinical problems of, how many students can you safely monitor in the clinical units, and then budget problems because it costs so much to educate in the nursing program because of our needs for clinical low ratios in clinical units. And I think that was sort of something that we continue to face, and later on as we got even further along and the university began to experience some budget problems, cuts, one of the thoughts was, well, let's look at all the programs. And I guess the thing, Miami is a liberal arts university. I mean, that is its focus, that's its function. And when the applied science department came in, even that was kind of looked at with some jaded eye, because should we have technical programs in our liberal arts college or university? And so even the applied science department had some problems. And later on we had a blue ribbon committee that decided that maybe we didn't need the applied science department anymore. And again, Dr. Shriver came to the assistance, I think, and saw that did not happen. But that was recommended by the general faculty. So I would say the university, up until maybe, recently now, did not accept technical programs as bona fide programs, not just nursing, but all those that were in the applied science department.
I think one of the real challenging things was the curriculum. Even as coming in, and I came here from a diploma, it was on an academic year, but yet you had more time. So I remember thinking, how on earth can all of med-surg, actually I taught that time med-surg and pediatrics. I had that whole bulk of area. Maternity was one trimester, and psych was one trimester, but the rest of it was in the two. And it was, for me, a real challenge to somehow figure out what was important that I could somehow compact in the curriculum for those two trimesters. And in a sense, the way state boards were designed at that time, we were talking about a major portion of the state board examination. So that was a real challenge. And then on top of that, after getting it into the two trimesters and figuring it out and teaching it through, we went to semesters.
The very next year.
So here was another challenge, because now we were faced with the idea we could not have a semester of psychiatric nursing, a semester of maternity nursing, and that left, we did this. where was surgeon and pediatrics and the like. So it was really another whole major challenge. So at that point, we were almost doing something like integrating psych, ped, and medical, psychiatric nursing, pediatric nursing, and medical surgical nursing. And and somehow we figured out maternity would go in the first year as the latter part, I think, of what was fundamentals or sort of. But see that when you went from this, it made a real difference because you couldn't have all of these entities as we had them at the before. Our courses were large too. We had something like 10 credit courses,
Which didn't go over well either.
which
Way
was
beyond.
a real challenge. So I think one of the big challenges was the curriculum development, and it was compounded by the fact that the university was going from trimesters to semesters. This university, I think, had been forced to go to trimesters
Right.
when the Board of Regents or someone decided that all universities in Ohio would be trimester. And then after a while, the board decided to allow universities to make decisions what they wanted, and immediately the faculty here voted to go back to semesters. And so you were caught in all of this.
They loved that early
transition.
semester because they had, students were out in early May and they got
Sure.
first choice on jobs. You know, that was,
Yeah.
and it really was a selling point for that. And the faculty, they just didn't think the regents could tell them what to do like that, but they had to suffer for
They
a
had to
couple
do it,
years or
yeah.
3 maybe, and then but we were right in the middle of the change.
Yeah.
We started with trimester in the very next year.
And as a nursing department, you know, whenever you make those kind of major changes in your curriculum, it's not only a challenge to make it and be able to plan a program that is a well-planned program, but you also have to go through the process of approval in state board. So that was time-consuming, and you didn't have months to prepare. It was like you were on this roller coaster of trying to do all of that. I thought that was one of the big challenges, and you wanted your students to do well. You wanted your program to be a good program, and we didn't have a lot of faculty, nor did we have a lot of support help, like secretarial support, on-campus lab, you know, those kind of things were not present at that time.
How did the BSN program evolve?
Well, very early on, as Jean mentioned, from the very beginning of our program, we were interested in a baccalaureate program. At the time, it was thought, well, you know, let's get this one off the ground, of course. And when we look back, I look back in the minutes not too many years ago, and as early as 1972, it occurred in our minutes that we were talking about this program. At that time, this was called, it's now called a completion program. At that time, we called it 2+2. So you did your first 2 years, which is the AD, and then your last 2 years would be leading toward a baccalaureate degree. We based this third year on the first 2 years, third and fourth year on the first 2 years. Well, nursing at the time, our real powerful nursing leaders, this is the statement they went, what do you people think you're doing? You cannot provide a professional education, a baccalaureate degree, on top of a technical background. It just can't be done. You cannot teach 2 years in your associate degree program, then build right on top of that a third and fourth year, 2+2. So there was not a lot of support among the major leaders in nursing. They felt philosophically that if you want a baccalaureate degree, you should start in the university with your first year and go for your 4 years, and all this time you're being indoctrinated into the baccalaureate part, baccalaureate education. So, but in spite of what many of our major nursing leaders said and thought, and were philosophic against it, more and more of these programs were being developed. And students were saying, you know, and Dr. Phelps told me, he said, you know, years ago, Montag said that this program, AD program, it stops at 2 years. And if you want to go into baccalaureate education, then you got to plug yourself in and start almost over again. And many of our universities were doing that to students. If you had an associate degree program, they wouldn't let you into a baccalaureate program until you made up whatever you hadn't had in the first 2 years. So that was but anyway, in spite of what many of our major nursing leaders were saying and doing, enough programs began. And so we were looking at what was going on, and we were one of the first schools, I think, that really looked at it, although perhaps we didn't establish it as early as some others were established. But anyway, it was a 2+2 program, and then we decided, well, it's actually more than 2+2 because many students are taking more than 4 years to do this, and the average student, in fact, was. So later on it became known as a completion program. But in 1972, I believe it was, we had our first faculty meeting around the possibility of a baccalaureate program. Of course, we looked at both the generic program, which you would start out in the first year, as we were saying our nursing leaders were talking about, and after 4 years, your nursing baccalaureate degree, versus the 2-year program where we would build on top of that. So we looked at that and we said, well, we didn't think certainly Miami is ready for this, nor maybe our students. And we have a lot of students out there that want to put on top of what they have done a baccalaureate degree. So we elected for that. So our discussions all centered around that from 72 on, and we had many, many faculty meetings around that, and finally developed some kind of a program that would lead to the baccalaureate degree. We presented this program to a faculty senate meeting. Well, first of all, it went to a unit that was preliminary to taking it to the main body. And that body has changed so often, I'm not sure what it was called then. But again, the university was in the middle of a budget crunch. People were, department chairs were being told, hey, you just, you're just going to have to cut down your budgets. We're going to have problems here, and the state is not funding us to the right amount and all that. So while the program was approved in this preliminary body, many of our supporters abstained. And like, for example, the chairperson of the microbiology department abstained, and he was a very close friend of nursing. But because of the budget problems, their faculty were saying, hey, we can't put any more programs here. Look, they're already cutting our budgets and we want a new, well, anyway, our friends did abstain and it passed. Then we were asked, of course, to take it to the major body. And so we did that. We were all ready to do it, and we talked about it. We publicized the program, what it was going to be like and what would happen and all this. And, the proposal and all, everybody had that handy. Well, they being the rest of the university, saying, you haven't given us enough time, we're not sure we want this, and the budget's right there all the time, the budget problem. So we better, okay. So you can bring it up, but we pretty well sure it was not going to pass. So the day of that was to be brought to the university-wide group, we asked to postpone action on it until the following September. So we did that, and everybody agreed. Everybody relaxed, I think, because I think we would have lost because of all the things going on at the time. Well, anyway, then, by the time we did get it before the floor vote, we had done a lot more work, and we worked with departments and publicized. We had a couple coffee clutches and things like that to bring people. And by that time, apparently the budget got a little better, and it didn't look as bad as it had. And it was there was quite a bit of discussion on it, but it did pass with, I don't know if there was 1 or 2 dissenting votes of the whole university. So those who were at the meeting, of course, which has filled the auditorium. So therefore, then it was passed and that. And then, of course, at that stage, we didn't have to go through State Board anymore. But then because once you have your basic program, State Board does not control programs beyond the basic. Now, they do control generic baccalaureate programs where you start 1 through 4 years, but because that's a basic nursing program. But they did not control that. But the National League for Nursing, and if you did control, not control, but accredited it. And as we had Miami, we didn't want to have a program that wasn't accredited. And so we certainly got our league accreditation for our AD program right away, as soon as we could. So we wanted to do the same thing with the baccalaureate program. So we did get accreditation as soon as we presented it. And so we really went on, and I think, again, we have a good program for the students.
Some of the other things that led up to some of this, though, as you said, in '72, and the entire faculty was somewhat involved. I think there were co-chairs at that time. Me and Joanne Tedman co-chaired what we consider the 2+2 program and sort of designed the curriculum for it. But in doing this, we also had a lot of meetings with various nurses in the community to discover whether there was even an interest in it. And we went to all the hospitals around and had meetings, and we developed questionnaires for them to fill out. And that was a support for the university to indicate that, gee, there was a need and people would be interested in attending. And so we had all of that kind of database that we sort of collected. We also got some ideas, what would you expect? Not that we would use them all, but we wanted to have some of that kind of involvement in it. And all of these things kind of went forward. And then, as Ruth Ann said, once it was approved, we had somewhat designed the curricular program, and we admitted classes on both campuses. And at that point, in order to grant some credit for previous nursing, we developed some tests that they had to take. And upon passing that test, then they were given some credit, like for the first level and the second level nursing courses. It's interesting, too, I think, that one of our first a student in the very first class on the Middletown campus is now a faculty member. And she entered the very first class. It's also, I would point out that a number of the nurses who came in indeed wanted to go on for their baccalaureate degree, but had a lot of anger among the students. So it was a time when you really, it was important that you help them to deal with the anger. The anger was not at Miami University. They were quite happy to have the opportunity very close. The anger was they saw themselves having to take so much, and they were already had experience and this education, and in some cases they had a lot of courses here and there, not towards any degree, but they might have had quite a number of credits to transfer, but they didn't see those credits being applied to the degree in nursing. So it was that kind of thing. Another thing of the anger was that some of them had been trying very hard over the years to get a baccalaureate degree and had been running into so many obstacles. And so they were, that kind of anger they brought with them too, because they had been to this university and that one, and the obstacles just seemed unsurmountable for them. So it was kind of an interesting time, and it did work out fine. But we admitted students on both campuses. And actually, when they graduated, they kind of were home-based. One other thing, the Board of Regents required that we students must take some courses on the Oxford campus. That was another barrier for some of them. And they could take anything, but they had to take some courses on Oxford campuses, and some of them had problems. Why? Well, the purpose was so that they could really feel a part of the university and actually touch a Miami Oxford student, or something, have that close connection. And the other, and later, the provost gave us some real concerns and some real problems, and almost caused the program to close. I mean, it didn't close, but almost was ready to phase it out. And that was an interesting time. But throughout all of these things, there was always a nucleus of support within the university. And somehow I think the faculty managed to have enough data, enough information to refute or to support whatever it was. So this is part of the growing pains, I think, of any new kind of endeavor.
But really, I think, the faculty at the time that this was happening with the provost is really to be commended, because it was this close, I think.
It was very close.
Now, I was no longer the director at that time, but it was very close, and I came back and worked a little bit with the people who were, trying to deal this with the provost, and But one of the things, going back just a minute with what Jean was saying, the provost said, you know, for example, and so did the Board of Regents, but apparently they sort of cooled down to do that too, but said you have to take some of the courses on the main campus, you know. Well, the provost lays this down. Everybody who gets a degree at Miami University must be at Oxford for some classes. Well, it so happened that in education, School of Education, some people have been getting baccalaureate degrees in education for a long time, never saw the Oxford campus. So when they start saying, well, now listen here, now you can't, so that helped us, because then another department said, hey, we're doing this, we're not going to go to Oxford. And the provost got himself in a hornet's nest, I think. And of course had to sort of withdraw that at one point. Now, of course, the provost is gone. He's no longer here, so we don't have to. But he was not, I feel, at the time, very supportive of nursing.
Yeah.
He did not. He, again, was liberal arts, and I don't think understood the procedures of nursing at all, and was not a supporter of ours.
But I think part of it was kind of not really understanding the academic aspect, but part was probably financial also. When you look at economics, I think that was the overriding view.
I do too.
You know, when you begin to look at economics, who can you perhaps delete and cause the less impact on the overall university? So I don't think it was out to get you kind of thing.
And early on, too, there were some enrollment concerns. There a couple of years, we didn't have as many people enrolled as we thought we would, and we were really kind of taken aback. I was anyway taken aback. Again, I wasn't associated at the time, you know, as the director, but taken aback a little bit the fact, because we thought we were have all these students. But all of a sudden, you know, that did change, and I believe their enrollments now are in good shape. But there for a period, and that was one of the factors that was in there when the provost said, you know, is this program viable? You know.
And there were a couple of other things. As we were going through this, then the decision was made that the program could only be on one campus.
Yes.
And so this made a change in the number of students, because where you were pulling students from Dayton and from Middletown, they did not want to come down to Hamilton. That caused some decrease, as opposed to when there were students admitted on both campuses, or even courses on both campuses. So there were lots of factors that were, you know, occurring at this point. But it is that because of that, the program became pretty much a Hamilton-based program in terms of where the courses were. It actually was to be an Oxford-based course program, but the courses then were all being taught on Hamilton rather than having courses on both. Our students admitted through both campuses.
When I left as the director, I had several little papers that I presented to various persons at the university, and I was concerned because many people on the Oxford campus did not even know there was a nursing program, and so that gave us a little bit of a problem. So when I left, I suggested that the program, at least the director, should be stationed at Oxford. No one knew the director. In my case, I don't say they didn't know me, but they needed somebody on the site up there. I thought maybe even living up there would be a good thing if they could, but that they needed somebody representing nursing at Oxford. So for a brief period, we were established at Oxford. The department was actually supposedly there, but that only lasted a couple of years, and again, another budget concern, and it looked like it was better to do it all at Hamilton or whatever, and that was another change.
Is there anything that you'd like to add that we haven't discussed so far?
I think I would only say that I think it is a program that certainly has been current, challenging, and has met the needs of a large number of people in the community. That was one of the things to make it convenient for people in the community. And maybe because I'm a little prejudiced towards the program somewhat, I think that it is a program that has maintained good standards, quality, and I think we've had students who have done very well. We have had students who have certainly been able to go on for the graduate degrees. We have students who, in many, many areas throughout the United States now, who have graduated from this program. the reputation, I think, is still good. I think we have people who are coming because they have heard of Miami. And that's a real plus, I believe, when we are surrounded by other schools who are also good. You know, we're not surrounded by schools of poor quality. And to have the students, number of people select, I think, says something good for Miami and for all of the people who are involved. I think, yes, there have been some difficult times. There have been many changes. We have seen a number of, say, chairpersons and the like. And with each chairperson, there have been some changes. But I think this typifies what occurs in any area when you have changes in some of the areas of administration. But the faculty has been strong. The numbers of students, and I think we will continue to face challenges. And one of the greatest challenges is going to be making sure that we are futuristic in what we do, that we recognize that it is not that programs can't be static, our curriculums can't be static, and we have to also be very much in tune with the greater society around us in terms of what's expected of people, of education. And I think that we are now at a point where we really can feel not a part of the university, only a part of the university as an individual, but we can feel that, hey, the university is seeing us as a program that belongs in the university, that is indeed academically challenging, that does really meet the standards of other programs within the university. One thing that I found interesting even, and I think was a little surprising to a few people, having been on the university council for a period of time when they were going through the liberal arts bit, trying to decide, several people would come up because I tend to be somewhat liberal arts prone, because I guess because of my own educational background. And they were a bit surprised, just a few people, at the idea that someone in nursing would be pro-liberal arts in terms of feeling that nursing too should encompass some liberal arts. But again, that's not unique as I see it. As we look at education of many of the professions, we're realizing that we want a person who is well-rounded. And a part of that is to also have some of that liberal education part. And I believe the university is beginning to see that. I think we will have some, I don't think it'll be smooth sailing. I think we'll always face economic challenges, academic challenges, faculty challenges, because what we haven't stated was not only have we seen changes in how we educate students, you've seen changes in expectations of faculty. It's a major challenge, and it is an uncomfortable challenge in many ways. So it's an interesting time in many ways to be here. In a short period of time, from post-World War to now, the changes have been tremendous society-wise as well as professional.
Yes, Jean has said it all, I think. Very good. One of the things, though, we talk about our challenges, our discussions, our disagreements with the university, and some of the problems we've had trying to convince them about what nursing is and why we have to do things a certain way. When you come back to Miami, I always had this grand feeling of belonging. And I believe the university tries to foster this, and I've always felt very happy when I come back here, and the people I meet who are now in the positions that, like as the dean of the School of Applied Science now, David has been so nice and so agreeable and so friendly and so supportive and appreciative of what's gone before, that it's just kind of a nice place to be. And there is a Miami man and there's a Miami woman, I think, and you see them at Miami, and you see them in some of the roles of deans and directors and presidents that just give a certain aura about Miami that I feel every time I walk on this campus.
I think finally, I would like to just mention some of the people who I think we should give credit to, who were early faculty and are no longer here because of retirement and the like. Evelyn Vandenberg, who was the first faculty member to teach at psychiatric nursing. Marilyn Halloran, who taught the first fundamentals course. Marguerite Miles, who taught the first fundamentals on the Middletown campus. Leon Sugarman, who was the first instructor for medical surgical nursing on the Middletown campus. Joan Techman, who taught maternity nursing, the first person to teach maternity on the Hamilton. And then when we started the Middletown program, she also taught the maternity nursing there. And those people, I think, played a very important role. They are now retired, but they certainly contributed a lot in the development of the program. And a few of the people who are here who were early ones, Eugenia Mills, who was hired, I think, after either about the third year of the program at the Hamilton campus. And of course, she is still here and is now chair director of the department. I'm trying not to miss anyone, and I have a feeling that I may accidentally have missed one of the earlier people. But, they came along in increments and at times, but we were still in the development stage, and they certainly contributed a great deal to the program.
One person we didn't mention was Dr. Jean Bennett, the campus director at Middletown. I don't believe we mentioned him.
Yeah, and he was very supportive in those early days.
And George Bowers, I think
out
we've
some of those
mentioned
people
him.
who are
Yeah, we sure don't
really
want to
very
do that.
helpful.
Yeah.
Really very
And
helpful.
George Bowers, who was our dean for all while I was director. George Bowers, who's now retired too, so certainly he deserves some credit. And the present dean, as I think I've mentioned, David Haddett, is certainly very supportive of it, and perhaps one of the most supportive persons that we've had in that job.
I want to thank you both for sharing your experiences and your insights with us. It's been a distinct pleasure for me to spend this time with you this morning. Thank you.
Thank you very much, and it was so nice to be asked and to know that the things that we've experienced through our really major portion of my life anyway, are going to be available in the future for people to see just what kinds of things we went through to develop the program.